type of diabetic are you? Do you know? Hi, I'm Donna Denson, the Dynamic Diabetic, and that's what we're going to talk about today in part two of this series. Last week in part one, I talked about the differences between type 1 and type 2 diabetes, what causes them, what they are, what the risk factors are, and what the symptoms are. If you did not catch that video, please go back and watch it because there's a lot of good information for you in there. But today is type 2. So now for the rest of the story. Part 2, excuse me. Now for the rest of the story. We're going to talk about the complications of diabetes, type 1 and 2. What can happen, develop from having diabetes? Well, cardiovascular risk are high. So risk of heart attack or stroke, risk of kidney disease or kidney failure, eye problems, even total loss of vision, nerve damage, mainly to your feet, hands, extremities, and problems with wound healing. In type 2 especially, we watch for that because gangrene can set in, and that's when you need amputation, and we don't want anyone to go there. And last but not least, ketoacidosis. So both types can suffer from those things. They also can suffer from high sugar, blood sugar, or low blood sugar. So high blood sugar would be hyperglycemia, okay? And if you have hyperglycemia, that's high blood sugar now, sustained high blood sugar. You might have an urge to urinate a lot more often. You may be a lot more thirsty. But this can develop into ketoacidosis. So you don't want sustained high blood sugar. If you were going into ketoacidosis, which is too many ketones in your blood system from having blood sugar too high for too long, you'd have difficulty breathing. You'd have a fruity smell on your breath. Might have nausea and vomiting. You might have dry mouth. And if not treated, this can lead to coma. So this is a big fear for diabetics, ketoacidosis. The other side of that is low blood sugar, right? And low blood sugar is hypoglycemia. So you've got hyperglycemia, high, and hypoglycemia, low. Symptoms of that are quite different. You might be sweaty. You might have chills. Might be anxious, okay? You might have a rapid heartbeat, feel shaky, nervous, like butterflies on steroids, right? You might be dizzy. You might be lightheaded. You might feel weak and tired. You might have a headache, and you might have some tingling in your extremities. If those symptoms are there, then you need some glucose, okay? So you need to eat a little bit of candy, drink some sweet drink, something that will raise your blood sugar, and then follow that with some protein to level it out. Without treatment for low blood sugar, you could end up with seizures, lack of consciousness, and eventually coma. So these are very, very serious complications. You want to carry a medical ID with you, whether you wear a bracelet, a necklace, or a card in your wallet, something that would let an EMT person know that you're diabetic, and then what type, so they know how best to monitor you and keep you safe, okay? So if you think you have those symptoms and now you think you might have some complications going on, have you experienced any of this, you want to see your doctor. You want to be checked. You want to know if your sugar is okay. And a regular checkup when you go to the doctor, he's going to do a standard blood test, and from that he can tell a little bit about where your sugar is. He may tell you you're pre-diabetic. That's like early type 2. You have time to take some precautions and some steps to change things so that that doesn't grow into full-blown type 2 diabetes. If you are type 1 diabetes, your doctor is immediately going to be putting you on some insulin, perhaps other medications, and a plan to take care of that and monitor that. If you're type 2 diabetes, that's usually discovered when you either have noticed the symptoms and had some of the problems, or you're in for a routine test and it comes back way high. That's when your doctor can tell that you have type 2 diabetes, and he's going to want to see you on a regular basis to keep track of that, monitor what's going on, and try to help you to stop the damage. So what other tests can they do besides that first standard test? The most common is called an A1C or a hemoglobin A1C test. And what that test does is tell your doctor where your sugar's been over the last 90 days. You know, have you been high? Have you been low? Have you been all over the place? What's it been doing? So he has a better feel for what's going on with you. Comes back and registers with a numeric value. So if you're normal, you would be less than 5.7 on an A1C test. If you were pre-diabetic, you'd be 5.7 to 6.4. And if you already are suffering from diabetes, you would be 6.5 and up. Okay. By the way, guys, if you don't have a doctor or you don't have insurance and you don't want to go to the doctor, you can get a test online that you can do to tell you where you're at so that you know. Because if you have diabetes, you do not want to mess around with it. You want to get help, get treatment, have a plan, because there is no cure. There is no cure for diabetes. However, there are some precautions and things that we might be able to do to help. So for type 1 right now, there's not much that they can do other than treatment. We're hoping in the future to have gene therapy and stem cell medication and pancreas transplant available to help type 1s. Also, treatment would be taking your daily insulin shots or a pump, an insulin pump that will keep your insulin at a good level. There are also drugs that a type 1 might be prescribed to take to help to monitor that sugar and keep it down. For type 2 diabetes, we can help control it, guys. If you are grossly overweight and have type 2, they might even suggest a gastric bypass to help reduce what your stomach will hold, to help reduce any sugar in your system. That's a pretty dramatic step. You don't want to do that unless you need to, but it is the only surgery I know of to help with that. But drugs are available, and most doctors are going to prescribe metformin as their first drug. Metformin is a powerful drug that reduces the amount of sugar that your liver produces, so there's less in your system. Other drugs that you can be prescribed help reduce your sugar level. They increase your insulin level, and they also will increase your insulin sensitivity, so your cells are more receptive. They can also reduce your sugar consumption in that they slow down your digestion. And then after those drugs, there's insulin to help for a type 2. But there's some lifestyle things we can do too. If you're a type 1, you got to follow your treatment plan. That's very important. Lead an active and healthy lifestyle. Get exercise, okay? But watch your glucose when you exercise, because exercise will affect how your sugar is doing, how your insulin is leveling. Manage your blood pressure. You want to have that in a good place, and also your cholesterol. You want that to be in good numbers. If you're type 2, again, you're going to follow the plan, but you're going to eat a healthy diet. You're going to move every day, get some exercise. Again, manage your blood pressure, and your cholesterol is very important. Avoid smoking. I would say quit smoking, because that's a big trigger for diabetes. And know what the signs of adverse complications are. The hypoglycemias, those things. You need to understand what they are and how they work. So to avoid those complications, what can we do? For type 1, again, follow the plan. Know those hypoglycemic symptoms and treatments. Wear a medical ID so that someone knows if you're type 1 or type 2 diabetic. Avoid infections or sores that don't heal, get a regular eye test at least once a year, so that if diabetes should be getting into your eyes, your doctor can find that and help you with that. Also, you want to go see a podiatrist every year to get your feet checked to make sure there's not something going on you're not aware of. Okay? Prevention for type 1, there is none at this point that we know. For type 2, again, you got to know those complications and the signs of them. Know what you're going to do if that happens. What should you do? Wear your medical ID, have it with you. Again, avoid the infections by checking wounds and making sure every day you should be looking at your feet and your hands and making sure there's no cuts or sores that aren't healing. Get that regular eye test, get your feet checked, and then a healthy diet. It's not easy to change your diet, but you can. You absolutely can. And get some exercise. You can do that too. Manage your cholesterol, your high blood pressure we talked about, because that helps to reduce cardiovascular disease. And quit smoking. Quit smoking. If you are diagnosed as pre-diabetic, do yourself a favor and get control now, because we can control type 2 diabetes. We can get that under control, keep it under control, unlike type 1, where at this point we don't know how to do more for that. So this concludes the information that I wanted to share about type 1 and type 2 diabetes, so that you would have some idea on what type are you. So if you still don't know after everything I've covered, please ask your doctor. If you're a diabetic, you need to know which type you are, because it matters. I want to thank you for tuning in today. I am Donna Denson, the Dynamic Diabetic. Hope this has been helpful for you. If you haven't joined my free Facebook group, the link is below. Please do. And may God bless and keep you till we connect again. Bye-bye.